me. I'm looking at Mike here, and show Mike. Mike works for the company Boston Scientific, who are the makers of this device. And Mike's helps me in the operating room, by the way. He's behind the scene bringing all the little device and has helped me for many years. And it's good for him to hear because he only sees that when I put it in and he doesn't know what happens afterwards. So I think it's very telling for Mike to see those actual patients that we've been implanting in the operating room, how much effect. So it gives Mike more energy to come to work and do what he does and feel his life is very, very worth it. This gentleman has a question first.
Yeah, I just want to tell you, I've been a Dr. Gousse patient since 2005. I went to a lot, but...
You said 2005.
2005.
So I haven't been a doctor for 13 years.
2005, yeah. I had prostate cancer. Diagnosed with Dr. Gousse. I followed his advice. He helped me a lot. And finally, I'm okay. But guess what? 2014, I ended up with colorectal cancer. So again, colorectal cancer, I ended up with problem with my urinary tract. I have to go back to Dr. Gousse again. But he's been very helpful. Let me tell you, I have surgery twice with Dr. Gousse, and I survived. But my advice is follow the advice of your physician. Have a good physician who can help you, and a good diet. Because now I can tell you one thing, I'm doing good. I'm working every morning, eat good. I retired last year, but again, follow the good advice of your physician. And Dr. Gousse, I want to say thank you for your help. You've been very helpful to me, very supportive to my wife. Thanks again.
Thank you very much. It's so true. It's like what I've learned by doing this is I don't only help my patients, I help their significant other, I help the wife, and the wives often give me the tightest hug, more than you guys. I thought I'd let you know today. They're so grateful because they know what you guys go through every day. And when we make a difference in your life, they feel it all. I could even say even more. And I want to thank all the supportive wives because I know it's not easy for you to be living with a man that was vigorous, was full of energy, was full active, and he developed prostate cancer, and bang, here's the effect in his quality of life just occurring so abruptly, and now you're wondering if there's going to be help, if there's going to be a way to restore the quality of life. So I want to thank all the wives here who are here today to accompany their significant other, and it's a great opportunity to thank you in this meeting that we're having today, which is the very first support group that we have by the Bladder Health and Reconstructive Urology Institute, Dr. Angelo Gousse, that we took the initiative in our community to speak up to help the individuals who are affected by the side effects of after prostate cancer treatment. So if anyone else needs to say something.
I just want to say that I actually didn't know Dr. Gousse, and I had prostate cancer in 2006, and a different doctor advised me to get some mesh, and I had it, and it completely destroyed my urethra. And someone referred me to Dr. Gousse, and he actually thought it wasn't as bad as it was, and he had to wake me up after he had given me anesthesia and say, well, good news and bad news is that your urethra needs to be rebuilt, but I'm the best guy that can do it. And he actually rebuilt my urethra with buccal tissue, which out of the cheek. And because it was complicated, it took a long time to heal up enough. But 2014, he put in the urinary sphincter, and it completely did change my life. And I've remarried, and things work through modern medicine and chemistry. We're very grateful, and that's my story.
Yeah, tell him that
And I did refer this guy.
we're friends and we're both newlyweds.
Oh, really? Okay. Well, there's something going on with these friends. There's part of a club. There must be another club going on somewhere in addition to this prostate cancer support group. It comes naturally to me to do the right thing every single time because I don't have to think about money, insurance, or anything else. All I need to think about, what is the best thing I could do for this person? I've had patients who've been upset at me because I don't operate on them. They're like, why you don't want to operate on me? You operated on my friend, and you don't want to operate on me. I'm like, listen, I get paid very well for operating on you. I could have operated on you, but you will not benefit from the surgery. And I don't want you to go through the surgery and not benefit from it. So I will not operate on you. And some of them get upset, but I prefer that. I live better because I know in my heart I've made the right decision that I didn't operate on the patient because they would not benefit. Some of you maybe have been testimony of that I've told them, listen, I can't help you anymore. There's no more surgery for you at this time that I think would benefit from you. I mean, if I know of somebody and who can do a better job or who can help you, I would gladly refer you to that person.
I don't know who your doctor is or who your doctors were. Do not be afraid to get help somewhere else when you feel that you're not getting helped where you're at. 4 years ago, I had a radical prostatectomy. I had 7 weeks of radiation and 6 rounds of chemo. I was experiencing lots of pain. I had a UTI that put me in the hospital for 18 days. I'm begging my urologist for help. I went through 6 urologists at a teaching hospital that's very famous. Begging and begging, I need you to help me. I have a tremendous amount of pain. I'm always wet because I'm totally incontinent. And all I would get was, well, I'll see you again in three months. It's like, you can't hear me? Someone that I know recommended a urologist, Dr. Kurzer, across the hall. I told Dr. Kurzer what my problem was, and he said, I can do this, 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 this. That's where I started to finally get some help. And I started to notice that Dr. Gousse was right across the hall. So I came in to talk about a sphincter. The preparation for my sphincter, Dr. Gousse gave me an antibiotic, and then he gave me a drug that would stop me from getting UTIs. No one ever did that. So now I have my sphincter. We're going to turn it on in 2 weeks, doctor. I can't wait.
I love your point. Ask questions. Like, really not be afraid. A lot of us say, we respect a doctor. I didn't want to ask questions. But it's your right. As a patient, as a human being, you want to know. And you should. I always prepare my patients to say, put your questions down on a notebook because there's so much information that you get at a consultation. Sometimes you forget. So just write all your questions for the doctor. And like Dr. Gousse, a lot of us love him because he does have that bedside manners. But it's because he loves what he does. For him, it's not work. It's his passion. It's one of his gifts to us. And so you can see that through a lot of other doctors. And listen, there's good and bad in everything, I think in every industry, right? But that is the great thing of just good doctors usually know other good doctors because they know of their work. If you're not, I've been in this field for about 7 years. I didn't have a clue prior to 7 years that this is how things work. And I started to learn, okay, because everybody's seeing everybody's work. So another doctor is seeing the other either good work or bad work. So it's just asking other doctors in the field, and that should give you a good recommendation.
I'm actually from the Caribbean, and I had a TERP and was put on hormonal therapy, and I developed complications, so I had to have radiotherapy. And just want to thank Liz for all her work and help, because it's through her I'm up here. And actually, I know she discussed my case with Dr. Gousse, and the point he made about not operating on people all the time, when Liz spoke to him and explained my situation, he really advised that I need to have surgery, I should have radiotherapy. And I do hope I don't have the complications which he mentioned. And as he did mention also, the complications are less now than they used to be before. But part of my problem, what I would like to, I was because of the TERP, and I already had meds. I was put on hormonal therapy, and so I have two problems: the lack of libido, and also the problem with the erectile dysfunction, and that is really what may lead me to the implantable. Although you did mention that there were the steps you take before you got to the implantables. So I just really want to thank all of you for sharing, and don't know if Dr. Gousse would have anything to say on the dealing with the libido and steps you can use before you get to implantables.
Yeah, well, that's the sexual dysfunction that can be the result of prostate cancer treatment can be very taxing to the couple. And the libido issue, and for those of you who don't know exactly what libido is desire to have sexual encounters or sexual activity, sexual fantasies, or everything sexual, about wanting to be sexually active. And a lot of it, not all of it, is mediated by a hormone called testosterone. And in many cases of, particularly in advanced prostate cancer, the testosterone is like what feeds the cancer. Okay, it's what really allows the cancer to continue to grow, is the testosterone that's in your body. So many times, as part of the treatment plan, one has to remove from your body, from your circulation, this hormone called testosterone. And there are many ways of doing it. In the good old days, often they would just remove both testicles, and that, since the testicles produce most of the testosterone, then that would really remove the testosterone from your body. Nowadays, there are shots, injections that you can take that will do the same thing, that would remove testosterone from your body. And this is necessary, unfortunately, for advanced stage, or certainly for cases of metastatic prostate cancer, meaning when the cancer already spread to your bones and outside of the body. So that will create a libido problem. Now, the testosterone hormone is not only important for the desire, but also it's important to have an erection. So not only it plays a role in desire, the testosterone plays a role in the ability to have an erect penis. So often the treatments, such as the pills, the Viagras, the Cialis, etc., that could help you with these erections don't work very well if you don't have testosterone on board. So you are in a dilemma here where the testosterone is not good for you because it's not good for your prostate cancer, and it's killing your life, your sex life rather. So that could be an issue. So often I tell patients, your survival is more important perhaps than, the sexual part at this point. Maybe in the future we can reevaluate, but continue with your treatment to save you as a human being, as a person. So I don't recommend testosterone replacement when your testosterone is low, or continued testosterone if you have advanced prostate cancer. Now, having said that, there are other treatments when the pills don't work, that you can have penile injections. That works quite reliably. You don't need testosterone on board to have penile injections. The penile injection, you have to inject it directly in the penis. It's a substance that you inject yourself each time you're going to have sexual activity. You inject it directly in the penis and you get an erection. Now, many patients have found it uncomfortable and cumbersome and not natural. There are many things I've heard, but others have found it a great solution, believe it or not. Some patients have found it to be a quite acceptable solution. Now, that's another alternative, and that won't affect necessarily your prostate cancer treatment or your level of, advanced disease and prostate cancer. So that's non-surgical approaches. The other option, there's something called a vacuum erection device. It looks like a canister. It's like a canister. You put your penis inside the canister, and it applies a vacuum, and the vacuum sucks the blood in your penis, and then you put a rubber band at the base of the penis to hold the erection. So you can imagine you put your penis in a canister, it applies a suction, you have a rubber band, you apply it to the... So many patients have found this to be too cumbersome, unnatural, and others have found it to be a good solution. But that's an option. Now, the option that suits every patient with severe erectile dysfunction is the implant of the inflatable penile prosthesis. That, even if you have metastatic prostate cancer, as long as you can withstand surgery, even if you have failed anything else, almost everybody is eligible to have the implant of the artificial urinary sphincter and of the inflatable penile prosthesis. Now, like any implants, it has its own issues, just same as the sphincter. Not the same type of issues, but it's a foreign body. You can have an infection of the device. That's a possibility. It's a mechanical device based on a hydraulic system, so you can have mechanical failure. That certainly could be a problem. You could have, discomfort. You could have this, but the majority, I would say greater than 85% of the patients have outstanding results from this. I mean, one of my most grateful patients are patients who have had the inflatable penile prosthesis. They feel they've recovered their life back, they've recovered their confidence back, and that had made them whole again because they've been able to have that sexual function that they used to have in their, quote, younger years, or at least their years prior to developing prostate cancer.
Thank you for watching. We hope you've been enlightened, educated, and hopefully we've created some awareness around this topic. You can reach Dr. Angelo Gousse at agousse@gousseurology.com. Again, agousse@gousseurology.com. And doctor, how can they call you?
Yeah, they can call me at 305-606-7028, 305-606-7028.
Thank you for watching again. We'll see you next time.